Hello and welcome to week 9. Can you believe our summer session is almost over? And today we are going to discuss critical health information management documentation related to dying. Okay, this is really very important. And as human beings, we are all pretty much guaranteed to die at some point. We don't know when. And that's why it's very important that every adult, regardless of their age, should execute advance directives. You do not need an attorney in any state. You do not need attorney, only unrelated witness. It doesn't cost anything, but it's very important to make sure that you let your desires known with regard to any health care if you cannot speak for yourself. And you may be 25 years old right now and do this, and in 5 years change your mind. Fine, no problem. Just execute new documents. There's not a problem. And again, they're absolutely free. You just download them from your state's website. Very important because different states have different requirements. So you want to make sure you use the correct form. And it's also very important that you speak to your patients about this, as well as your friends and family. Okay. Advance directives are multiple documents, legal documents, that allow the patient to say, yes, I want this, and no, I don't. All right, let's try this again. If you cannot speak for yourself, these documents, advance directives, are multiple legal documents, cost you nothing to file, that you do not need an attorney, only a witness who is not related to you. And if you change your mind, you just fill out new documents. The most recent date will prevail, okay? And this is just so you can say, yes, I want that treatment. No, I don't want this treatment, if you cannot speak for yourself, okay? This makes things a lot easier. You know, God forbid, COVID is a good example. We had over 500,000 people on ventilators who had no way of knowing this was going to happen. And sadly, we're not done with COVID yet. So this is an important thing, but also accidents happen, things happen. And remember, as long as you can speak, you override any documentation. This is only if you cannot speak. So let's talk about the different documents. There are living wills, and we're going to talk about these in more detail. Durable power of attorney for healthcare, also known as a healthcare surrogate. Okay, or you may see POA healthcare. POA is short for power of attorney. Okay. A DNR, which means do not resuscitate, and organ donation. If you want to donate your organs or tissues,
great. If you do not, if you feel strongly about not doing that, then put it in writing, and then everybody will understand what you want, even though you cannot vocalize, okay? So a living will tells, and most of the forms for living wills will give you a checklist. Yes, I want this. No, I don't want that. Which treatments the patient wants if he or she is dying or permanently unconscious. If you go into a vegetative state, you cannot speak for yourself. Okay, this document can speak for you. You don't have to worry about your children having to make difficult decisions for you, particularly if you want to refuse any treatment. Now, this can cover things like, there are some people who are of a religion who don't believe in transfusions. So if you don't want a transfusion, if you don't believe in that, then you can have this in your living will. And if you cannot speak and say, no, I don't want that, then the document will speak for you. Okay, so this covers a lot of different varying possibilities. And we know in this world, you can never predict. Okay. Again, if you can speak, you say what you want, that's what you don't want, that's what you get. Okay. This is to speak for you, what your desires, what you believe, nobody else. Okay. Identifying a healthcare surrogate, also known as power of attorney for healthcare, is identifying someone who can speak for you. This is a good thing to have in addition to the living will, because by the time you need it, God forbid, you may not be able to cover all the possibilities. There may be experimental medicine. There may be a new, maybe you want your head frozen. Maybe you want your whole body frozen, whatever, okay? The respect can only be for you to honor what you want as a patient if it can be communicated. So the document is to enable the communication to happen even when you cannot speak. Now, having a proxy, which is a human who can analyze, you want to pick someone who has similar feelings. Maybe it's a religious thing, maybe it's an attitude thing, whatever, okay? I'm not here to judge. This does not judge. This just lets you document, okay? And just one thing that is recommended, it's not forbidden or anything, but it is recommended that you do not choose your child to be your proxy. Because even if you sit down with your child and you say, I do not want this, okay? It's still a very difficult thing for your child to say, no, mom said she doesn't want to be on a ventilator, so let her go. Even if everybody agrees, so if you can pick a best friend, a close friend, maybe a priest or a rabbi or an imam or whatever to speak for you, it's better that you don't, because that can haunt a child, okay? And when I say a child, I mean an adult child, of course. All right, and I want to reinforce to you that this is not just for the elderly. A lot of times I hear students say, oh yeah, advanced directives, well, my elderly parents, I'll have them do it. I don't need it, I'm only 30. Well, Terry Schiavo was only 26 years old when she fell into a persistent vegetative state after suffering cardiac arrest. This was a nationwide blowout in 1990. I mean, even the Supreme Court, the governor of Florida, because she was living in Florida at the time in a long-term care, her husband and her parents were at each other's throats because the husband said he didn't want her living like that. It wasn't living. She just laid there. And the parents did not want to give up. So doing this, even if you're 20 years old or 21 years old, is important to have that intelligent adult conversation with your family, but also be responsible to have your feelings documented, because the doctors, by law, by the United States Constitution, have to give you the right to make decisions for yourself as long as you can. And these documents give you that right even after you are unconscious or just cannot speak or communicate. Okay. Again, all of these documents are available for free. Download them from your state, because each state is a little bit different. It costs you nothing. You do not need an attorney to execute these documents. And then once you do, make sure you give your primary care physician a copy, and keep a copy, give a copy to your surrogate, of course. And if you go to the hospital for any reason as a patient, bring a copy along with you. Okay? All right. Okay, read chapter 12, do the homework on chapter 12. And this is a great movie. I have it linked into the course, Baby Girl Scott. It's a Lifetime movie from the late 1980s. I think it's 1988. But it is a wonderful movie about a premature baby and making decisions about what can possibly help. It's an excellent, well done, with Mary Beth Hurt and John Lithgow. It's an excellent movie about ethical decision making and the various aspects of that. Okay, you know, I'm here for you. I'm here for you. And all you have to do is email me, and I'm happy to help. Okay, have a good evening.